Molly, the recommended target cholesterol level for men and women is less than 200 milligrams per deciliter of blood, according to the American Heart Association. Please tell us what cholesterol is and why is this number important, and how can you go about getting it checked?
Yes, so thank you, Diana. Cholesterol is a waxy substance. It's found in the fats, or often what we call the lipids, in your blood. And it is essential for the body to build and maintain healthy cells and essential hormones. Most cholesterol is made by the human body, but a smaller amount, approximately 25% or so, comes from the foods we eat, particularly from things such as meat, fish, and dairy. So there are actually two forms of cholesterol. One called low-density lipoprotein cholesterol, or LDL cholesterol, also known as the bad cholesterol. Then the other type, high-density lipoprotein cholesterol, or HDL cholesterol, is the good cholesterol. So too much LDL cholesterol creates plaque that can accumulate and clog the arteries, and this is what can cause heart disease and strokes. HDL cholesterol, however, is good because it carries harmful cholesterol away from the arteries, helping to protect from heart attack and stroke. On the next slide, I think we'll talk about the fact that high cholesterol actually has no symptoms. So many people do not even know that they are at risk. But there are known factors that can increase the risk of developing high cholesterol. Some of these factors you can control, which are highlighted here in green, such as diet, physical activity, and weight. Others are out of our control, but we know they still affect cholesterol levels. These are things here in red, such as family history, age, unfortunately risk increases with age, and gender. For example, postmenopausal women are at the greatest risk.
To increase good cholesterol, or HDL, and lower bad cholesterol, LDL, what should a person do?
So the good news is that you can take several steps to improve or maintain cholesterol levels. One of the first and important things that we can do is replacing saturated fats in your diet with unsaturated fats. So saturated fats are usually found in animal products, things such as beef, lamb, pork, poultry with the skin on, butter, cream, cheese, and dairy products that are made from whole milk. Unsaturated fats, which we want to increase in the diet, include omega-3 fatty acids. And these should be used in place of the saturated fats mentioned a moment ago. So some examples of foods containing unsaturated fats would be fish, such as salmon, trout, and herring, things like avocados, olives, walnuts, peanuts, and liquid vegetable oils, such as soybean, corn, safflower, canola, olive, and sunflower. The next step is a little shorter. It is adding soluble fiber to your diet. So some examples of soluble fiber sources would be oats, fruits, vegetables, and legumes. The next step is one we all know, but perhaps don't always do, exercising regularly. We want to try to achieve at least 150 minutes of exercise every week. Maintaining a healthy weight is another important way to maintain a healthy cholesterol level. So another important step is to avoid smoking and also to avoid exposure to secondhand smoke. Of course, it is also essential to talk to your healthcare provider about your cholesterol numbers, treatment options, and if medication might need to be considered.
How do you check your cholesterol, and how often should a person have their cholesterol checked?
So cholesterol can be checked through simple blood tests. The American Heart Association recommends having cholesterol levels checked every 5 years, starting at the age of 20. And your healthcare provider will tell you if you should fast before your blood test. To fast, it is recommended that you do not eat for 9 to 12 hours prior to the test. This can help to more accurately measure the total cholesterol, LDL cholesterol, HDL cholesterol, and the triglycerides in your blood. You may need to have your cholesterol and other risk factors assessed more often if your total cholesterol is 200 milligrams per deciliter or higher, if your HDL cholesterol levels are lower than 40 milligrams per deciliter, or if you have other risk factors for heart disease and stroke.